So what is your name and what is your title?
My name is Ariel Garcia. I'm a paramedic here at Lone Star EMS. I'm C-shift supervisor.
All right. And how many years you been in EMS?
I've been in EMS total since I got my basic in 2010, so 15 years, going on 15 years already.
And what made you join EMS?
At the time, I had gone the whole college route to try to study kinesiology, but I didn't really like the whole college experience, so I decided I would go for something that was a little bit quicker, and I wanted to start working. So I had a couple buddies that were already paramedics. I said, "Hey, go get your EMT basic. It's like one semester, and you come work where we're at." And I was like, "Yeah, you know what? I'll do that." So went to STC, and yeah, sure enough, in one semester, get your basic, and then at the time the intermediate, which if you do it in the summer was only in a couple months. So I jumped into that right away, and then once you're there, it's like you do one more year, a couple more semesters, and you have your paramedic. So so I went straight to do that, to do the paramedic, and it just happened very, very quick. After the first semester of basic, started working, and then you start wanting to do more in the back of the truck. So then you get your advanced or intermediate, and then you want to go even more, learn more, and be able to do more. And I decided I'd go for my paramedic.
What makes you want to stay, or why are you still in EMS? Like, what is it about it, if anything?
Honestly, in the beginning, I really liked the 24/48 schedule because I felt like I worked 2 days out of the week, sometimes 3 days out of the week. And I had already done some Monday through Friday, 9 to 5 stuff. And initially I was like, no, I didn't want to go back to that type of schedule. I liked the time off, spending my days off with my family. 24-hour shifts didn't seem as long. So that was kind of what kept me in it for a while. But then, you start doing more, you start going to more calls, you start treating people more, and every once in a while, you see like how much of a difference and an impact you really have when treating these patients. I know a lot of the time we feel like maybe we don't make that much of a difference in the short time that we have our patients, but every once in a while there's a few calls out there that you really made a big difference in this person's outcome and in the way they're going to live pretty much the rest of their life, even to the point that living at all. So they're not as common, but every once in a while you really see the impact that you make, like right then and there, even if it's something small, like just fixing somebody's blood glucose where you see a difference right away, or somebody that's having an overdose or a really bad allergic reaction. And little interventions that you do here and there have like a big difference in that patient's outcome and quality of life after, from like recognizing somebody that's having a stroke, recognizing somebody that's having a heart attack, where you seeing it and recognizing it and getting that person to the right place, like, makes a really big difference in how they're gonna live like the rest of their life. Yeah. So I think that's what kept me in it. That's pretty much what's keeping me in it now. And then now it's more like on this side of it, this supervisor role, I'm learning so much more. And it's like a whole another side of EMS that I had never, knew before. It was just on my truck, treat my patients and go home. And this is, a little bit more involved. You see the other sides of EMS, like, in the background, behind the scenes. And I'm just glad I'm like soaking a lot of it in right now, because it's like my first year as a supervisor or in any type of leadership role. So I'm soaking a lot in, I'm learning a lot, and I'm just trying to just broaden my knowledge, of just EMS in general, which is why I'm doing it right now still.
And is that what motivated you to be a supervisor, like to apply for the supervisor position?
Yeah, honestly, yeah. I wanted to do something different. Like you do calls, for 10 years, right? But like some of this stuff that I'm learning now, you never get to see unless you take on a supervisor role, right? Initially, I was a little reluctant to do it, just because I like being out in the field. But as a supervisor, even like little things that you can do to help the crews out, like scheduling or, just little things that you can do here and there. It's just really good to be able to do that. And I still get to go out and respond to calls and treat some patients. So it's kind of like the best of both worlds, and I don't have to do the documentation.
Yeah. How big is the workload compared to just being a field medic and then a supervisor? Like, as far as like the physical load or like just in general,
Yeah.
what is the difference, or is there a big difference between?
Well, I'll tell you this, like from before when I would work my 24/48, when I would get out on my first day off, I felt like, I don't know if it's the years or the job, right? But I felt like I had more energy and more time to do stuff. And now I kind of get out, and honestly, there's times where I'm kind of beat, even though I'm not out in the field and responding to a lot of stuff. And it's not necessarily like a very stressful job. Like the guys here on my shift like do a really good job of doing what they got to do. But I feel like there's just maybe it's a little heavier on you mentally. Maybe I don't know. Just
Yeah, it makes sense.
you can't really completely disconnect.
You're thinking about a lot more.
Yeah, you're thinking about stuff, and we're in the group chat, or I'm looking at emails, and you're just always trying to think of what you can do to for this issue, or to make this better, or in response to this. So it's kind of like on your days off, yeah, you're off and you disconnect, but you don't completely disconnect. Whereas where I was on a truck, I'd go home and I'd be off for 2 days. I wouldn't think about anything until I came back, and then you start treating your patients again, and you just go. It's just routine. And now, yeah, on your 2 days off, you can have a meeting here and there, or like I said, just reading emails.
So you're not really off.
Yeah, you're not.
Okay.
You're not really off.
Oh, that's interesting.
Yeah.
Any advice to anybody, like as far as whoever wants to be an EMS or EMTs, like what advice would you give yourself then, or anybody right now?
Honestly, I think the one of the biggest things, or one of the best things that you can do, is just to try to learn as much as you can. In the field of EMS in general, you learn in school, right? They teach you everything that you need to pass a test in school. Once you get out in the field, you get your experience, you start learning. But there's just so much more that you can learn about. There's just so much in medicine in general. So I think one of the things that I kind of wish I would have done, or I can still do, and I'm probably gonna do, is try to get like my flight cert, critical care. There's just so much out there. You don't just have to learn your protocol. Like there's just so much more that you can learn, and just broaden like your knowledge within the same field of EMS.
Yeah.
So I think that would probably be one of the best things to do, is just to continue learning, continue with your CEs. Don't let go of your national. That's the thing. Try to keep that as much as you can, and yeah, just always continue learning, and just strive to do the best you can. Like, be a good medic, knowledge-wise, know what you're doing, but also don't forget that compassion, right? And just being a good person, just treating people with respect, just having good bedside manner with your patient, with family members, people that we interact with out in the field. We deal a lot with other agencies, staff at hospitals, at receiving facilities, fire department, police department, just people in the community. I think that kind of makes you like a well-rounded medic. You know, you want to be smart. You want to know what you're doing. You want to know how you're going to treat this patient. But you also want to be able to talk to people, you know, and try to. Sometimes all you need is really just to comfort them, you know, not so much interventions, but comfort them, talk to them, you know, try to keep them relaxed, and just do the best you can to get them to the destination, you know, as safely and as healthy as possible.